exploring the culture, the adventure, and the impact of martial arts. And today our guest is going to be Suzie Foreman. She's a physical therapist who's an expert in body movement and in particularly has quite a bit of experience with martial arts. We're going to talk about specifically today knee problems as they're associated with martial arts and our journey through the impacts that we take through martial arts. I hope you'll enjoy it. We want to welcome Suzie Foreman to the program, and Suzie and I have exchanged a couple of emails, and today most of what we're going to be talking about is martial arts, traditional martial arts, and knee problems, and perhaps a couple of little orthopedic things will pop up along the way. We would identify her as a physical therapist, but as she's getting ready to explain, there's some different titles that go along with the same role. So Suzie, thank you so much for joining us. Please introduce yourself, where you are, what you do, and those kinds of things.
Okay, thanks, TW. So I'm Suzie Foreman, and in Canada, it's called a physiotherapist. Also in Australia, I believe in England, I know in Jamaica, we're known as physiotherapists. In the States, it's physical therapist, but it's the same thing. So we are specialists in human movement and in assessment and treatment of faulty issues, pathologies for human movement. So physiotherapist, physical therapist, all the same thing. And I'm based in Toronto, but I do have a virtual practice. And so I do see people around the world.
So within the virtual practice, we have, programs where we have docs that will see a patient online. So if it's warranted, then they can actually diagnose, exam, as much as they can and prescribe from right there on the virtual online setting. And for many of the patients, that has been something that's been a godsend.
Yes.
For a variety of reasons. Now you and I didn't get to talk a whole lot about it. I kind of threw it right at you there in the last few minutes about, most of the things with Kung Fu Podcast is all about, we exploring martial arts at different areas. And martial arts is, by nature, a contact event, right? There's some bumps and bruises along the way. And there's also a lot of physical movement and sometimes in direct confrontation with somebody else's physical movement. So it's not just movement, it's movement with resistances at time. And the earth is a great reminder that she holds the biggest fist of all, right? So you can hit that thing pretty hard.
Yeah, right. I have some experience, not with many different martial arts, but in my younger days, when I was doing a lot more sporting events, I have a lot of experience with karate.
Oh, very nice. You're going to be very popular in this program. We have a lot of karateka that listen to this program.
Yes, I used to work a lot of karate events in my younger physio days. So actually on site at the side of the mats, working and seeing people. I worked quite a bit, all right, with karate.
Well, so with that being said, did you run into or see or currently do you work with acute and or chronic knee problems that, and it doesn't have to be necessarily with martial arts, but with the sort of activities associated thereof?
Very much so. So in the mornings, I've got my virtual program, which is for people with hip and knee osteoarthritis. So that's more chronic. But in the afternoons, I work in a clinic every afternoon, and I work in a very active neighborhood. I work in a very affluent neighborhood in Toronto, and they all ski and run and cycle. What else do they do? Golf, tennis, all kinds of stuff. So I do see acute fractures. I see tendonitis. I see dislocated patellas, fractured patellas. What else do you see? A lot of meniscal injuries to the knees. And then, of course, I do see people after surgeries. So after knee replacement, after hip replacement. So I certainly do see acute and chronic. It's actually the clientele I love. Orthopedics and sports is my favorite part of physiotherapy.
As a side note, you mentioned it in there. I went to graduate school up at Appalachian State University, which is in the mountains of North Carolina. And I'm not the sort of person who puts things on their feet besides shoes and socks, right? But one of the things that used to happen is that during the skiing years or the skiing months up there, I worked in the sports medicine department and as one of the assistant strength coaches as a graduate up there. And one of the things I remember so clearly first is that, my brother and friends would like to go up to the mountain on the weekend to go skiing. And I would go up there to watch periodically, but it was amazing how flooded our sports medicine department would get, because one, we would get athletes who, let's say they were on the volleyball team or the golf team or any team, right? And of course, when it's beautiful up there in the mountains, there's not too much to do if you don't get into the local activities. So one of the things that would happen is that the athletes would go up there and go skiing, and sure as heck, they would tweak something just enough, and they needed to get therapies as fast as they could before the coach found out, right? That, that before they had to get back on the mat or back on the floor again,
Right.
come Monday afternoon practice, they needed everything that they could get in order to head it off. So those acute problems sometimes were little like nickel and dime things, but speak for a moment, if you don't mind, about how those little nicky kind of achy things that happen to the knees in the area around the knees can accumulate over the course of time, both through aging and as well as more and more. How does that impact that joint, particularly over the course of years?
Okay, well, let's talk because you mentioned, just little tiny little tweaks, right, that cause you pain.
Sprain,
but
strain.
when you're young, they settle down pretty quickly.
Mm-hmm.
I'll give you a common example. If somebody's skiing, would be maybe the ski just went out a little bit too far and they just strained the medial ligament of the knee that attaches to the medial meniscus. They tweak it. It's sore for a couple of days. They have trouble bending and straightening it. But usually if you're young and you're healthy and you're strong, within 4 weeks, you're pretty good and back. But those are the types of things that over the years can set you up with a little bit of excessive wear and tear, because you may be just a little more lax now in that knee joint. If that meniscus got damaged, the meniscus is there to protect the cartilage. So over time, things can happen. Other things that happen, and this doesn't have to happen on a ski hill. This happened to me this past summer. I was coming downstairs. I didn't miss the step. I almost missed the step, but I caught myself, and I didn't feel anything at the time. But in hindsight, I strained my left groin, and then asking that strained muscle to do day-to-day activities, standing in the clinic, walking, going upstairs, it started to really rebel and get really angry, onto the point where it just ached to stand, right? So those little injuries over time can gang up on you. And sometimes it doesn't take much time, 6 weeks, and they can gang up on you.
So let me ask you, now as you were talking, I was thinking about it, that would it be fair to a degree, or at least a larger or lesser degree, to taking an activity like skiing, where there's somewhat unpredictable forces going in and throughout the body, a constant changing of terrain, and through the knees basically handling all of the adjustments that need to occur, much like, in my mind, like in karate or kung fu, any of the martial arts that you're practicing with, especially if it's live with someone else,
right?
Usually most of the time, if it's organized, it's on some sort of mats, right? Now when I was training, we didn't have mats. We were always either on asphalt, grass, or sand,
right?
Would it be fair that some of the activities and motions and jarring and things like that would happen in skiing might be sort of similar to the sort of actions that you might expect for what to happen to someone who is practicing or training the martial arts?
Definitely. Depending on what type of skiing, obviously, if you're doing a green slope, a blue slope, not as bad, right? You're not getting the impact, right? But if you're doing moguls, right, you're going to get a lot of impact, right? One of the other common, so if we're talking skiing and we're going to compare it to martial arts, with martial arts, a lot of times you might be on a planted foot, right? And you twist on a planted foot. And that is going to probably give you one of the worst injuries you can have with your knee. And it's something that happens in skiing if somebody catches an edge and their skis don't release. Okay.
Mm.
So on a planted foot and twisting or a ski that doesn't release will usually lead to torquing at the knee and your biggest injury, your ACL. And if you really want to go big, you get what we call the terrible triad, which is the ACL, the MCL, and the medial meniscus. They go together. So that's perhaps the worst injury that can happen to a knee. And you can certainly see it on a ski hill many times. You can certainly see it in martial arts, right? You know,
Wow.
when somebody's blocking you, when you turn and twist on a planted foot, you can certainly see it.
No, please go ahead.
I was going to say another common thing if you turn on a planted knee is a dislocated kneecap, right?
Okay.
You may see that more often in your young females, right? But again, if you turn on a planted knee, get a sudden contraction of your quads, you could see a dislocated kneecap as well.
So, you know, over the years when I'm working in the clinics, having someone with a floating kneecap, so to speak, right, in the scheme of things, seems to be more of a real annoyance, if not, you know, an impediment,
right,
as compared to a real tear, you know, a real,
right,
you know, a real rip. So if you don't mind, take a moment and explain for the audience the difference between a sprain and a strain through the knees, or if they're
okay,
what the difference may be, how they might be able to identify what's going on with them.
Okay, well, let's talk about it. So sprain and strain. So let's talk about sprain first. So when we're talking about a sprain, we're referring to ligament injury. Okay. And there can be different grades of a sprain. You can have a grade 1, which means that you've just stretched it a little bit. So as I mentioned earlier, on the ski hill, you know, your leg goes out to the side just a little bit more, and you get a little bit of a medial stress to the knee. So you might just get a grade 1 sprain of your medial collateral ligament. So it's just a little extra stretch. There is no bleeding, no bruising, no swelling, just some pain, right? Clears up usually pretty quickly. A grade 2 would be a partial tear. So you've torn some of the fibers and you're definitely going to get bruising and swelling now. And then a grade 3, of course, would be a complete rupture. And depending on which ligament you rupture, it may be a surgical issue. So in Canada anyway, I'm not sure what happens in the States. If somebody were to completely tear their MCL, the doctors still go with conservative treatment here and good physiotherapy, right? Because your secondary source of stability are the muscles around the knee. But if it's your ACL or PCL, those are really crucial ligaments in the knee. And we know that if you do not repair them, and even if you do repair them, down the line, you're going to have a very arthritic knee, but you will have less arthritis in that knee if you do repair them, right?
Okay.
So that's sprains. Sprains refer only to ligaments. Now, if we talk about strains, strains are all about muscle. Okay. And again, we can have different degrees. So your first degree, you just stretch a muscle a little bit more than it should. It feels like a pull, it's achy, but there's no bruising, there's no bleeding, there's no big dysfunction. You might be out for 2 to 4 weeks. Then a partial tear, you're definitely going to get some bleeding, some bruising, and more dysfunction. So you may be out for 6 to 8 weeks. And if you get a complete tear, I don't know if you've ever seen anybody with a complete hamstring tear from like flipping head over heels in water skiing. They are completely black and blue down the back of the leg. There's a big divot in the tissue and a lot of dysfunction. And you're looking at probably about 3 to 6 months of rehab. So to recap, strain goes with muscle, sprain goes with ligament.
Well, I had strained my hamstring playing college football.
Yes.
And I felt like I was at practice, and it was the first time in my life I ever had a hamstring problem. And it wasn't a full, as you were saying, but it was enough it dropped me. It felt like somebody shot me in the back of the leg with a 22 rifle. Yeah. I mean, it literally dropped me right down. And I worked really hard. I lost my scholarship after that because I couldn't perform.
Right.
It was good. But it took me a good couple of years. Actually, once I started the Chinese martial arts, part of the work was a requirement of some of the stretching that we would do with the activities. And some of the stretches I had never done before.
Right.
And it was the first time, like 3 years after I had strained that hamstring, I thought I was fine. But my bilateral symmetry, as far as my performance on this, oh my gosh, it was bringing a whole new thought of pain to me. So,
Yeah.
yeah, as you were speaking about that, it was bringing back some memories.
Yeah.
So, you have actually taken care of one of the questions here magnificently about common knee problems. What? Give me an idea if someone like a martial artist, a karateka, a kung fu,
Mhm.
any sort of martial artist, let's say that their knees are already healthy. They could be like 18 to 35, 40 years old, but their knees are so far, as far as you know, we
Mhm.
know that they're in pretty good shape. What sort of things should they be doing, not doing, due to the activities? How do they prevent and take care of themselves to keep those knees healthy?
Okay. That's a very good question. So I'm going to say my male patients are a little bit more guilty than my female patients because everybody likes to do their activities. They like to do the martial arts. They like to ski, cycle, play tennis, play golf, but not everybody likes to strength train. Okay. Now, there is the most current research in the world, okay, for hips and knees, is coming out of Denmark. And prior to this research, when we used to get knee patients, we'd focus on the quads and the hamstrings. We might give you squats, we might give you lunges, but nobody really paid that much attention to the glutes. And what came out of this research was many of us have glutes, but they're not working. They're not firing, they're deactivated, they're not working at the right time, they're not as strong as they should be. So out of this program and out of this research came the importance of the glutes when it comes to not only knee, but hip and low back function. And so if I'm going to tell anybody, if you have healthy knees, what to do, I recommend a strength training program. You want definitely to have glute work in there and all of the glutes. So your glute max, your glute med, your glute min. You also, of course, want to have your quads and your hamstring, which is pretty traditional. And then you want to have your combination exercises that are teaching you that proper coordination with your glutes and your quads. So like lunges, like squats, but you want to make sure that you're really pushing through the heel as you come up from a squat or lunge so that you're engaging your glutes and hamstrings and not just using your quads. Okay. So proper strengthening program. Thankfully, gone are the days. I mean, years ago, I've been a physio 35 years. We used to give patients strength training every day. Well, we have learned that the muscles actually grow when we rest.
Right.
So once a week is not enough. Twice a week, you get maximum muscle growth. 3 times a week, there's a little bit more benefit, but it's not statistically significant. And that's why you see, I mean, the big bodybuilders are usually only working a body part twice a week, right?
Okay.
Because this is what the research is showing, right?
Okay.
But for the people with healthy knees, do your activities, but do not forego 2 days of strength training.
Okay. So, and I'm going to come back to one part of this. Let's say that we have someone who is pretty young, let's say 45 or so, and they're not having real chronic sort of diagnoses or, and things like that, but they do have a lot of like crickety, like the accumulating nicks from the years past. And they're going through the same sort of karateka, their kata, a little bit of sparring and things like that. It takes what I call, it puts a little bit more tax on their joints than perhaps what it did 15 years before that. What about those folks? Now what would you suggest for them as far as their recovery and their training to keep themselves as healthy as possible?
You know what? Throughout the whole thing, whether you're healthy, you're just starting to get achy, creaky, you are really bad, or you've had joint replacement surgery, the same muscles control the limbs, the same muscles control the motions. So the strengthening program is the same. Okay. Now so when I say the strengthening program is the same, obviously every patient that comes to us is not the same. Right. One might have had ACL injury, one might have had a meniscal tear, one is 75, one is 60, right? But the group of muscles that need to be strengthened are the same. Right. However, somebody who is stronger or has lesser injury might be doing level 4 of a glute exercise, and somebody who's much more deconditioned might only be doing a level 1. But for, whether you're healthy you're just starting to creak, you really are creaking, or you've had joint replacement surgery, the same muscles need to be strengthened.
Okay. So the strengthening program being set, then what about the sort of things that you have seen over the years that identify, let's say, a flexibility or imbalance? One of the things that we do a lot in the physiology is that, we can have everybody's got their strengthening programs, but sometimes it's the ratio between this muscle group and how flexible is that other muscle group. What's some of the most notorious types of or culprits that would contribute to knee pain from your perspective?
Okay, perhaps the most common, you briefly talked about it, you said a floating kneecap. Okay, so perhaps the most common is patellar maltracking. So the kneecap not tracking properly. So the kneecap is actually a bone within your quadricep muscle. It has a ridge behind it that corresponds to a groove on your thigh bone, and it should ride up and down like a sled in a track. Now, for various reasons, it can be slightly off track, and then you start getting wear and tear. You get the grinding sound, you might get swelling, pain going up and down the stairs, difficulty kneeling on the knees. If you sit for a long time, you get pressure building up behind the knees. So that is a pretty typical complaint. And that is the three main reasons. One is a muscle imbalance in your quadricep. You're tight in the lateral quads and your iliotibial band, and you're weak in your medial quads. Okay. And if anybody's had even the mildest injury and a little bit of swelling, the medial fibers are the first to weaken. So that is a very, very common, very, very classic knee muscle imbalance issue. Aside from just the muscle imbalance in the quads, though, for that particular ailment, you also need to look at your glute strength, and you also need to look at your foot and if there's any overpronation in the foot. But that is perhaps the most common muscle imbalance injury. Okay. The other thing you'll see is a muscle imbalance with your quads and your hamstrings. So one of my clients now, she tore her ACL in the past, had surgery in the past, is quite strong. She's a past physical education teacher, but she was having trouble going up the stairs. And she said one key word to me that reminded me, oh, we've got a muscle imbalance here. And that was shearing. She says, I get this shearing pain when I go up the knees. And as soon as she said that, I recalled she's a past ACL injury, and obviously her quads were too strong, pulling that knee forward. And if her hamstrings aren't the counteracting force, she's getting that little extra shearing and stress. So in the last month, we've really focused on her glutes and her hamstrings. And she said to me earlier this week, Suzie, you hit the nail right on the head. That pain up the stairs, gone. I don't even think about the stairs anymore. Perfect. Right. So that's another common imbalance between the quads and the hamstrings.
So earlier you mentioned the medial quads, the medial fibers being the sometimes a culprit. What type of exercises if you had one or two, would someone do to try to focus on that area?
Okay, so what I really like is terminal knee extension exercises. So terminal knee extension. So the medial fibers of the quads work best in the last 30 degrees of knee extension. So there are a couple ways. I'm sure you've seen the basic exercise where people put a roll under their knee. It's just slightly bent, and then they just straighten the last little bit. That's one way to do it. Or you could stand and you could put a TheraBand behind the knee. So that's the elastic band that we give for exercises behind the knee. And what you do is that band, now the force is going to pull you to kind of bend your knee. So you're going to lift your heel, and then you're going to straighten the knee against it to get that last little bit of extension. Okay. Another way, you could lie face down, tuck your toes underneath, and then straighten your knee from there. So those are three. And one final one. If you have a small ball, I wouldn't say as small as a tennis ball, maybe, what do you need?
Baseball?
Sorry, what kind of ball?
A baseball?
No, still a little bit too small. You almost want a soft, squishy pool toy.
Okay.
Right? Okay, or a yoga ball, right? And if you place that behind your knee, so that is you're standing against the wall, you place it behind your knee so that your knee is slightly bent, and then you straighten your knee and push against that.
So you'd be
That is
pushing the
also,
ball against the wall.
yes. Okay.
Okay.
So
Okay.
those are all 4 variations of terminal knee extension. And I watch clients with patellofemoral problems really settle down their symptoms with
Okay.
whichever one of those they like doing best. Of
Okay.
course, I also get them to roll their IT band. They hate me for it.
Yeah, I understand.
Yes, most athletes are very tight. It's very sore. But the ironic thing is, the more consistently you roll, the less tight it will be, the less sore it will be. And it really has an effect on the kneecap. It has an effect on the hip, all kinds of stuff.
Yeah, that iliotibial band is a real beast, and it doesn't like to give up the tightness that it has achieved over the years.
Yeah. And you know what? I think, I'm not 100% sure, but I seem to recall, I think it was the Williams sisters that started the rolling craze, right?
Oh.
If I remember, the foam rollers we used to give people kind of stability work and balance work on, right? The original high density foam roller. And I don't know why I remember this, but I think it was one of them who was just fooling around, and they started rolling their IT band, right? And rolling just became more and more common, and everything can be rolled. And I'll tell you right now, in my eyes, sure, we still give patients stretches, but a physio worth their weight in gold is also making sure their patients roll.
Okay.
Right?
And you're just talking about one of those devices that's a cylinder shape that rolls on the floor, and those types of things. Okay.
Yeah, the original, it was white, high density foam roller. Now there's some mean looking ones out there. There's some ones with tread.
Oh yeah.
Teeth.
I got one of those things. That thing will make you cry.
Yep. Yeah.
So, one of the things I had on here, and you kind of alluded to in the very beginning, if someone has identified they've got some sort of knee problems, and based on what you shared with this earlier, that they've really identified it. And when I'm talking with patients, I'm usually very clear about how do I say this? If you go to a chiropractor, they're going to want to adjust you. If you go to a surgeon, they're going to want to cut you, right? If you go to a pharmaceutical provider, they're going to prescribe you something, right?
Yep.
And I'm of the opinion for myself that I'm going to take the least invasive path first and maximize that before I put anything in my mouth for my liver, and definitely before anybody's going to take a blade to me. Right.
Okay.
But that's my opinion. Right. But when it comes to knee problems, how would you prioritize saying, look, I just need to go straight to the doc and get somebody to give me some medicine, or do I need to see my physiotherapist or find one? How would you recommend for folks to move forward with something like that?
I am so glad you asked this question, because I'll have to tell you honestly, there is quite a difference between the medical system in Canada and the medical system in the States. Okay. A lot of it has to do with the setup, social medicine versus a more privatized system, right? And also, and I can say this because I started my doctorate in physiotherapy out of the University of Florida. And I remember when I was taking it, the director of the program we were doing a differential diagnosis course, to tell, is it tendon, muscle, ligament, whatever. And I remember the director of the program saying that 25 years ago, when she was working, they could only, as a physiotherapist, address range of motion and strength and whatever the doctor told them to do. And I said to her, well, I graduated 25 years ago, and we could tell if it was ligament, tendon, or muscle. And her comment was, I love you Canadians, you're so way ahead of us. Because in the States, physical therapists are still very much looked on as rehab and after surgery. And in the States, people, if they can afford it, can get surgery tomorrow. You don't have a 2-year waiting list like we do in Canada. And what has happened, because we have a 2-year waiting list in Canada, and I think we're a little bit more developed with manual therapy, is the doctors have come to rely on physio and send patients, if they have to wait 2 years, they send patients to physio, and they're realizing that many conditions will get better with conservative treatment and they don't need to go under the knife. So there is actually a stat that in the States, many people are getting surgery when they don't necessarily need to. They could have gotten better with conservative treatment.
Okay.
Thankfully, there are many people like you. They don't want medication. A lot of people don't like taking drugs, the effects on the liver and everything else. And there are more and more people who don't want surgery. And thankfully, also, there are more and more people who are realizing that surgery isn't always, it's not a quick fix, right? Because regardless of if you get surgery or not, you cannot get away from strengthening, right? Right. Now, with that said, there are a few conditions where I think you need to go to surgery first. So if you do have a complete rupture of your ACL, surgery. Okay, we know the history, we know you are going to get arthritis in that joint. So I would get it repaired and then you go for your physio, right?
Okay.
But if you've torn your meniscus, certainly here in Canada, the surgeons are no longer, they're not even sending clients for arthroscopic surgery, because even though it's minimal incision compared to what they used to do years ago to open up the whole knee, it is still traumatic to the knee joint. They're in there scoping and pulling and yanking around, right? So they ultimately are finding it's causing further degeneration of the joint. So they're sending them to programs like what I've got online, right?
Okay.
And the research out of Denmark, so this is where a lot of this research came out of, shows, and by far, strengthening exercises far outweigh medication and or surgery when it comes to controlling knee pain and function, right?
That's fantastic.
And again, like I said, it depends. If it's an ACL, that's a whole different thing. But for torn meniscus, if you've got arthritis going on, if you're mild to moderate with the arthritis, even if you're severe, don't let your imaging dictate your life, right? Because some people can have severe pictures, MRIs and and x-rays, but if they're doing the right things, they're functioning actually quite well.
I like that. You remind me of a provider. One time I was watching a patient as they were rehabbing. It was a cardiac patient, and they started throwing PVCs on the EKG and things like that. And I'm watching it, and of course, I knew it was a person who had a history of 2 heart attacks and a bypass surgery.
Right.
So when they just started throwing PVCs and that kind of thing, I'm 24, 25. I'm starting to, like, oh,
freak out.
Yeah, right. And the doc looked at me and said, "Look, Tim, yes." Because I called the doc over and said, "Look at this, look at it." He said, "Look, yeah, got it. Thank you. Look at the patient first, though. How does he look?"
Right.
He looks fine, but it's my watch, So anyway, it speaks very much to what you were just saying there. Don't let your image dictate your life. Just like I had to learn, don't let the EKG dictate everything either. I mean, there's thresholds in this process. What about from your perspective? And I don't know where you may how you may respond to this at all, but how about supplemental work? Things like if I was taking my physiotherapy, do you have analgesics or herbal approaches or things I should be BCCAs or something like that? Do you have any recommendations for somebody?
Okay, so that's beyond the scope of my practice, but let me just talk as a lay person. So it's not just all about strength and your knee. It's whole body wellness, right? Okay. And so in my program, what I am doing once a month is I am interviewing. I've just started this year other health practitioners, and I'm interviewing them on different topics. So it may be on supplements. So last month I interviewed a naturopath from Saskatoon, and we talked about the different supplements, whether it be omega-3s, which is settles down a whole body inflammation. Boswellia. I don't know if you've ever heard of Boswellia, which is Indian frankincense. I learned from her that is a natural anti-inflammatory, okay? And comparable to non-steroidal anti-inflammatories. So your naproxen, your Voltaren, that kind of stuff, or Voltaren. We talked about collagen. A lot of people are taking collagen, bone broth. We talked about what else? Glucosamine, chondroitin. I can't comment on dosage and stuff, but these are all things that are out there, right? And other supplemental things, yoga, restorative yoga, Pilates, core strengthening. The stronger our core, the better our limbs. So sleep, right? The gut microbiome. I don't know if you've been hearing, I mean, lately, probably the last 5-6 years in medical circles, all you hear about is the gut. All right. And the what do you call it? The bacteria in the gut. So your probiotics, your good bacteria, your bad bacteria, and that a healthy gut leads to less inflammation throughout the whole body. It improves brain health, it improves joint health, all kinds of stuff. Right.
Okay.
So yeah, certainly there are other things other than certainly just strengthening your knees. You need to look at the body on a whole, getting the inflammation down, getting everything wellness.
Okay. Well, so last couple of questions. First, any direct advice to any martial artist out there who's practicing things to just, as a former karateka, as you described yourself earlier, things that you've seen over and over again and say, look, just make sure that you do this, right? Is there anything in there?
Yeah. I would say take the time to do your strength training twice a week. Okay. So core, glutes, quads, hamstrings, and then combination multi-joint, multi-movement. Okay. And do it with proper guidance. Okay. Also in martial arts, flexibility is a big issue, and flexibility, unfortunately, is not something that you can do twice a week. We should be, and I'm preaching now because I don't do enough myself. We all should be stretching more and rolling if we have to. But stretching and mobility work is something that we need to do much more consistently. We need to do it daily. So if we could all get into a routine of 15 to 20 minutes a day, I know we're all busy. I'm trying to do it as myself. I'm trying to get into a nighttime routine, but so your flexibility and then you're strengthening twice a week to augment your martial arts. Martial arts, excellent form of fitness. I've seen some very, very fit, very strong people, but do the basic strengthening, because when you're doing basic strengthening, you're actually strengthening a muscle in the action that it is designed for. Right.
So as an instructor to the audience, I would supplement that in saying that as a student, make sure that you take the time and get with your instructor about what are the proper mechanics of the technique that you're working on. Particularly, that when you're planting a foot and you're going to be moving, whether it's a side kick or if you're going to be moving through that, you take the time to learn how to do it first right. And then take your time to do it smoothly, and then build up to a little bit more speed. Mechanics being one thing, I think one of the things that I see the biggest issue is patience. You take the time to teach the right mechanics, but the student have the patience to go through that, and that as an instructor that you require them to take the time to get it right before they start welling on some heavy bag over there. And all of a sudden they've tweaked themselves out and set themselves back from the very thing that their goal was in that training. So that's two questions. So you've mentioned the virtual program. Please take 30 seconds or so and tell us about, as you've mentioned, that you can actually, if someone in the audience wanted to find you, they could actually sit down and do an assessment with you right online, even from the States.
Yes, even from the States. Okay. So I have a virtual physiotherapy practice at www.SuzieForemanPhysiotherapy.com.
There'll be a
the
link.
Program that I'm running online, okay, aside from the virtual practice, is called the Joint Pain Relief Program, and it's for people with hip and knee osteoarthritis.
Okay.
And this program is a 2-month coaching program where the class, think of it as a medical exercise class. So the class is led by a physiotherapist, physical therapist, and it's done deliberately because historically patients will go to physio, they'll get exercises, they'll do them for a couple of weeks, then something happens, they go on vacation, they fall off the bandwagon, they don't get back on. And so they're not doing them for a long enough period of time to see good results, okay? Or if they're really good and diligent, they're doing the exercises, but they're doing what we gave them today 3 months from now. And they should have long been progressing them and making them more challenging so they get stronger and stronger and stronger.
Okay.
So everything about this program has been research and evidence-based, right? So it's a 2-month coaching program for people with hip and knee arthritis. As I said, think of it as a medical exercise class. And the benefits of being a physio teaching it over, say, a personal trainer is we assess and treat injuries. So when somebody comes back to me, like that client, and says shearing pain, I know, oh, no, wait a second, ACL, your hamstrings. I can put that together, as opposed to if I only knew anatomy and exercise form, I may not clue into that, right?
That's right.
So yeah, and the best way to find me, my email address, that is the best way, is Suzie, SUZIE _Foreman, FOREMAN @hotmail.com. Whether you're in the States, Canada, England, wherever you are in the world, that is the easiest way. I'm always on my email and I'm very responsive. So if somebody's interested in either just doing a one-off assessment, or if they're interested in learning more about the program, it's best to email me.
Okay, that's fantastic. And I can't tell you, there are loads of information that you provided here today, both at as I would describe as at a very high level, for folks who have got some problems, and those who just need to stay safe as they move forward through their activities. So, Suzie, I can't tell you thank you enough. And I think what I'd like to do, if you don't mind, is to put a bookmark in this and perhaps bring you back in, and maybe we could talk about hips on another one and shoulders on another one, right?
Sure.
Because those are especially the shoulders.
You know what? I'm happy to talk about. I've only done orthopedics my whole career. I'm happy to talk about any orthopedic issue from the jaw to the big toe. Surprisingly, I have a lot of experience with the jaw, and jaw problems are real. People who clench and grind, right? So I will talk about any joint. I'm very happy to. And I've really enjoyed this, TW. Thank you. Thank you. I'm not sure how you found me. Was it through podcasts? Andrew Ullman? Yeah. So thank you. I've really enjoyed this. And happy to talk about anything to do with orthopedics and sports injuries.
Well, we'll have you back, and we'll talk to you again real soon.
Okay. Take care. Have a great day.
Too.